Okay, so welcome everybody. This is week 8, the first lecture of this week. And this whole week is about therapeutic landscapes, principles of healthy architecture. And so really today's lecture and tomorrow's lecture will be hopefully helpful for you guys to start thinking about your second assignment. We'll be talking about lots of theories and things like that, things that you can apply to your assignments. So hopefully you'll find that useful for this week's lectures. Today, obviously, it's me giving the lecture, but tomorrow we'll actually hear from a guest lecturer who will have some really interesting kind of real life experience to share with us from her work as a landscape architect. So let's go ahead and get started. Now, I want to take just a brief moment to reflect, given that next week officially marks 1 year since the COVID-19 pandemic began. Which indoor spaces have you felt happy in over the last year? It's been a pretty different year compared to years prior. And specifically thinking about which indoor spaces have maybe had some benefits to your health, which spaces may have had some aspects of healing that you felt. Does anyone want to share in the chat if you feel like sharing? Reed says greenhouses. Oh, interesting. Yeah. I can imagine greenhouses would be a really soothing kind of healing place. Anyone else want to share? Maybe you haven't felt that indoor spaces have been particularly healthy, and that's totally valid and also a possibility, right? I think a lot of us have come to realize that maybe the places that we call home aren't necessarily that health inducing. So that might also be something that you've discovered over the course of the last year. But yeah, so today's focus will be mostly indoor spaces, whereas tomorrow we'll let the guest lecturer kind of take over more of the outdoor environments and how those might be used to benefit health and healing. But it's good to keep these things in the back of your head as we go through the lectures this week. So what do we mean by therapeutic landscapes? What does that entail? Well, it was a term that was first coined by a researcher named Wilbert Gessler in 1992. And so therapeutic landscapes, although landscapes, we tend to think of something as more having to do with outdoor spaces, the physical environment. Therapeutic landscapes do include other types of environments. So it's any sort of environment that provides that sense of healing, sense of place that would induce good health. So this can include the natural environment, things like green space. So Reed mentioned greenhouses, that could certainly be incorporated as an aspect of natural environment. Scenic views have been known to also have sort of health-inducing qualities, but also other environments like the built environment. So the way that both indoor and outdoor areas are designed, maybe whether they're accessible or not. This includes the social environment as well, so interactions between different humans, the way that even something like furniture is set up in an indoor space, whether or not that is conducive to social interactions between individuals. And then, of course, the symbolic environment. So symbolic environment really has to do with cultural identities, whether or not an environment has ties to any historical significance, so things like that. So therapeutic landscapes can be diverse. They're not just landscapes the way that we might traditionally think about them. They do include these other types of environments. Now, a therapeutic landscape is generally understood as some sort of transaction between a person and a place. So that's what really makes it therapeutic. Now, this can be influenced by material or aesthetic qualities of a place. So whether or not they're appealing to you, whether they're aesthetically pleasing in some way. It could also have to do with the presence of physical structures located in the place. And this is particularly true for any sort of design having to do with accessibility needs, right? Any physical structures that may inhibit people's mobility, for example. There's also, of course, social interactions that are really important, and that ties into that social environment aspect, as well as cultural and symbolic experiences of a given place that someone might be visiting or a part of. Now, does anyone know where this place is? Does it look familiar to anybody? If anyone is familiar with Toronto, maybe you've seen this place before. Anybody? So for those of you that maybe aren't too familiar, this is underneath the Gardiner Expressway, which is sort of this major highway in downtown Toronto. And so for years, they've been trying to figure out what to do with the space underneath the bridge. It's not maybe the best environment that you'd envision for something like community events or things like that. But surprisingly, over the course of the last 5 or so years, they've really transformed the area underneath the Gardiner Expressway. So this is the area around Fort York, if anyone's familiar with the kind of geography of the city of Toronto. So they've included something like a skate park, lots of natural features. There's a little museum there as well. And so they've really tried to incorporate these aspects of healthy designs or therapeutic landscapes to make it a space that's much more comfortable, maybe a place that people would actually want to visit, to hang out, to do some physical activity, things like that. And so I think it's really going to be interesting to see how in the future we push a lot of these types of spaces that maybe aren't traditionally thought of as healing or nice or pretty to look at, in ways that we can actually transform them to really make them a much more comfortable, healthy place to visit. So how do we actually know if something is a therapeutic landscape? How do we measure that? What proof is there? Well, remember that we talked about a lot of these indicators for measuring health. Sydney asked the question, is there potential complications with having people gather under major highways? Short answer is yes. But when you compare that to the people who are living there, and especially in Toronto, there's many condo buildings that are literally right beside this highway. And so, you know, if you're someone who's just visiting for an afternoon, I think people wouldn't be overly worried about potential hazards. I'm assuming you might be thinking about air pollution, for example, from a highway. So certainly, if it was 4:30 in the afternoon in the middle of traffic, maybe you would want to avoid that particular setting. If you were someone who suffered from something like asthma, for example, maybe you would want to avoid in general areas that might have a lot of traffic. But I don't expect the risk would be significantly different from people who already live in that neighborhood who kind of are surrounded by the highway on a regular basis in any case. But that's a good question, Sydney. So, well, we would measure the health impacts of therapeutic landscapes just as we would with any other sort of hazard or environmental exposure, right? So this is something that we've thought about before at the beginning of the course. And so remember that there are two main ways that we would want to examine a health study and to see whether or not something has an impact on a health outcome variable. So the same sort of way of thinking about it applies here. So using quantitative methodologies from health studies, you could use something like a case control study, right? So hopefully that rings a bell from the first assignment. So that's where the health outcome variable that we're measuring is really some sort of clinical or medical health indicator. For example, maybe we want to look at the impact of green space on survival or some disease incidents like asthma, maybe blood pressure measurement, something like that. There's also ways that you can incorporate qualitative methodologies from health studies. So this would include something like interviewing study participants. Now, the impact of that would obviously be based on someone's personal experience. So it might be a little bit more in tune to individual experiences, but that's also really important to study, right? Especially if you have a diverse population living in a neighborhood, you would want to hear from a diversity of different views to make sure that you understand the context from a variety of people. And of course, this could be used to measure something like mood or pain, which again are generally thought of as much more individual health indicators. Now, one of the sort of founding experiments on therapeutic landscapes, the whole reason we know about therapeutic landscapes, was this experiment called Room with a View. And it was conducted by a researcher named Roger Ulrich. And so between 1972 and 1981, what he did was that he examined hospital records of patient recoveries who had undergone gallbladder surgery in a hospital. And he was interested to know that given a group of patients, what their health outcomes might be based on the kind of room that they were recovering in. So you'll notice here, some patients were in room A and some were in room B. Now, the main difference between them is that the ones in this area A had a view of nature. So they were looking at trees, they were looking at shrubs, other natural sort of greenery. Whereas the patients who were recovering in room B, those were unfortunately subjected to a pretty ugly view with just a brick wall, sort of the side of the building. That's all they could see. So they couldn't actually see this view of the greenery that the other patients had. So this is an example of how you could easily kind of apply both quantitative and qualitative approaches, right? You might be interested to know about the patient's experience, how they feel, what their well-being is, but you would also want to measure health indicators like, you know, how quickly they're recovering from their surgery, were there any complications from surgery, things like that. So what did he find? Well, he found that patients recovering in area A, so the ones with the view, had performed as better than the ones in B in a multitude of different ways. So to start, they required shorter hospital stays. They required less pain medication. They had fewer post-surgical complications, and they had fewer negative comments from nurses. So the nurses were there to kind of monitor them and comment on any sort of disposition or change in moods that they may have had. So the nurses found that they had fewer negative things to say about the patient's disposition. So they're in a generally better mood, not as stressed. So what did this study tell future researchers of healthy designs? Well, for one, it was really important to establish this idea in a very empirical way that yes, access to nature can improve health and well-being. I'm sure many of us kind of know intuitively that that can be the case, right? Many of us go out for walks specifically because we feel that sense of health or well-being whenever we're outside around nature. But this was kind of the first time that a researcher was able to really document it in a scientific study in a way that other people could replicate and kind of criticize or critique. We also learned that the effect of places on health and well-being can be effectively measured and that they can be quantified. So we don't have to only rely on qualitative methodologies, for example, to gather people's experiences. These can also be studied in other ways, more quantitative ways. We also learned that places can be designed to foster better health and healing, right? So we can manipulate environments in certain ways to really induce better health or better healing. Now, this study, in the figure here, was a study in Denmark. And so Engelmann used satellite data to classify the physical environment by the amount of green space at the individual level. So they had about 1 million people in this study and 1 million people's residential addresses, and they classified those residential addresses based on the amount of green space around it that they were looking at from the satellite imagery. Now, they're interested to know in this study whether someone's childhood residence, so how much green space they had during childhood, would impact their risk of psychiatric disorder later in life. What did they find? Well, yes, that high levels of green space during childhood was associated with a lower risk of psychiatric disorders later in life during adulthood. And this relationship, interestingly, remained even for different types of community settings. So it was consistent whether or not you lived in a rural area. Granted, it was a little bit less different, depending on the amount of green space, probably because there was, in general, more green space if you lived in a rural area. But this is particularly true for places like the capital in Copenhagen, as well as other sort of more city urbanized environments. So why does nature improve health? Well, there are a few different reasons or theories that have been studied, and so we'll go through some of these today. So the first sort of reason or theory is this idea of biophilia. Now, biophilia, it just means the love of life or the love of things that are alive or living. But this can also be associated with certain smells or sounds of nature. So I found this really interesting study in the figure here. And in this study, they did a randomized control trial in order to explore the effects of nature-based sounds on the physiological responses in patients who were being put under mechanical ventilation support. And so they were interested to know, well, did the patients who were being put through this process, this mechanical ventilation, were the ones that were exposed to nature sounds going to have better health outcomes? Would they have better physiological responses compared to those who were not exposed to these nature sounds? You know, what impact does the sound of nature have on people's health? What did they find? Well, among the experimental groups, so those that were exposed to those sounds, they found that the patients who were played those sounds had significantly lower blood pressure. So you can see that here in this intervention group compared to the ones that did not hear the nature sounds. They also found a difference in their anxiety. So those patients who were being put under ventilation, the ones who were listening to the nature sounds tended to exhibit less of those anxious anxiety symptoms compared to the ones that didn't. So again, this is something that can be empirically proved. It doesn't have to rely on people's experiences alone. Something like anxious responses can be quantified based on sort of nurses watching over patients. And you can absolutely collect this kind of empirical data to really prove that the impact of nature does have impacts on health and well-being. Now, another important theory, kind of building on that, is this idea of prospect refuge theory. So prospect refuge theory is this idea that since early human civilizations needed nature to survive, right, thinking back to hunter-gatherers from thousands of years ago, just based on that, we are sort of programmed evolutionarily as humans to be attracted to nature because we associate nature with survival and our needs based on resources that we used to go and collect in nature. So based on this idea, researchers theorize that humans feel safer and more secure. They feel healthier in places with a clear view. So this idea of prospect, when you have a clear view of something, you can see out ahead, you can see danger potentially in front of you. But also this idea of refuge. So humans tend to feel comfortable in places where they're not necessarily too visible, where they're not worried about being seen, particularly in open environments. Now, this principle, this theory has been really used in the real life scenario in terms of how people have designed indoor and outdoor spaces as well. And so you see this a lot in hospital settings, this idea that humans tend to respond better when they have a clear view, especially of nature or the natural environment. And so a lot of places, whether that's hospitals or other facilities, have really kind of emphasized this idea of having clear views of nature in natural settings. Now, another theory that's used to sort of support this idea of nature and impacts on health is stress reduction theory. So stress is just the process of responding to events and environmental features that would be challenging or demanding or threatening to our well-being. So it is hypothesized that nature-dominated settings can reduce stress in two main ways. For one, they can induce feelings of restoration by helping people feel grounded. But on the other hand, they can also offer people a temporary escape through distractions, so distractions through the natural environment. Now, to kind of illustrate this, I found an interesting study, and this was done out in Sweden. And what the researchers did was that they had a group of participants, and they divided the participants into three groups. So some of them they sent out to urban environments, some of them they sent out to forests, and some of them they sent out to parks. Now, what they did next was that they subjected these patients or these participants in the study to stress using mild electroshock stimuli on their skin. So they just, they had a little sort of mechanism that they put on the people's skin, and it would stimulate them with a little bit of an electroshock. What did they find? Well, after these participants were kind of subjected or exposed to this stress period, the ones who were in the urban environment had a significantly higher stress response, and this was measured by their stress hormones, their cortisol levels. Compared to the ones who were in the forest or the park, those participants tended to have much lower stress response. And this was maintained even in the recovery period. So even after these participants were no longer being exposed to this sort of stress stimuli. So again, some empirical evidence for this idea that stress can reduce negative health outcomes. It can certainly reduce stress. Nature can reduce stress, or nature can reduce stress. Now, another kind of related theory is what we call attention restoration theory. So remember this idea that nature can really distract us from other things. Well, this kind of takes that into consideration. So it's hypothesized that one way to tackle mental fatigue, because increasingly a lot of us are spending a lot of time indoors staring at different screens, this really requires a lot of intense concentration. And so this is what we call directed attention, this kind of intense focus that a lot of us have to use for long periods of time while we're doing work. Now, one way to tackle that is to break up the day or break up different tasks with both directed attention and indirect attention. So indirect attention is what we call these fascinating experiences or moments that we observe. We're not necessarily studying something intently, but we're just sort of freely observing something, not putting too much focus or energy into what we are looking at or doing. Now, this is also why a lot of academic or university institutions have increasingly thought about this and incorporated aspects of the natural environment, whether that's gardens close to libraries or things like that. They realize that a lot of students do find it beneficial when they're taking, let's say, a study break to just go out, be exposed to some kind of natural living environment and kind of take a break from that intense period of focus. So one example that I always really loved, I did my undergrad at U of T, and this kind of urban bamboo forest is what they put in one of our medical science buildings. And so I remember coming out of a stressful chemistry class and just making sure that I would walk past this indoor garden, because I did feel kind of this sense of relaxation and relief after a really long lecture to just sort of take a deep breath and unwind a little bit before I would go on to my next class. Does anyone know any examples at Mac? On Mac's campus, that would be maybe something similar. I don't know how much time many of you spent on campus last year before you were forced to go home, but if anyone remembers any aspects of what campus was like. Pinky says the MDCL waterfall room. Yeah. Yeah, so Mac also kind of decided to incorporate something similar. So for those of you that did get a chance to see it before campus closed, the trees in MUSC, yeah. Yeah, so there's a few different examples of different campus design aspects that are kind of taking this in mind, this idea of attention restoration theory. So how can we design an indoor environment to improve health outcomes and well-being? Now that we know a lot of these kind of theories, theories that inspire a lot of these aspects of healthy design, let's take a look at some of those principles, those kind of rules for what we would want to keep in mind. So this first sort of principle of healthy architecture is really designing for the user in mind, because of course there's many different types of people, there's many different needs that people have when they are interacting with a particular environment, especially an indoor environment. So one idea is emotional congruence theory, and this just means that an individual's emotional state can impact how they experience a place. So if someone is stressed and they are in a stressful environment, that's just going to exacerbate their stress. So if you know that you're designing a place where people might feel anxious or stressed, particularly at an airport, for example, if people are, waiting for a flight or they miss their flight, it tends to be kind of a high stress environment. So what they did at Gatwick Airport, which is in London, they incorporated this sensory room, which are called snuzzelen rooms. And these were originally invented by the Dutch, but they have kind of been embraced by many countries around the world. And what these rooms do is that they really inhibit or exhibit this multisensory environment. And so they use different lights, different smells, different sounds, different textures as well are involved in order to kind of help people feel soothed by a different set of stimuli, different sensories. This has also been proven to be helpful for some people on the autism spectrum disorder. So this is also, broadly used for a variety of different people, a variety of different health kind of impacts. Now, another important aspect or principle of design is this idea of place attachment. So place attachment just has to do with culturally, historically, or symbolically relevant designs that would help people make that link to their cultural identity or their ethnic identity. And a sort of cliche example of this, but one that I'm sure many of us have come across, is anytime you visit a Chinatown in most North American as well as European cities, you tend to notice a lot of design features that are really there to sort of culturally and symbolically help the community feel that link to their identity. Now, some would contend that this is a bit of a cliche and that it doesn't actually help people feel that connection, but other studies have found that a lot of these types of design features that really are an homage to people's culture can help them feel that connection to their environment, that sort of symbolic environment. And this might also help them with feeling comfortable to interact with other people, especially if they are in a cultural enclave. This could kind of help them feel like they're a part of a community and feel really established in their community. So from that perspective, it's still important. Now, another aspect, is this aspect of designing to enable opportunities for social interaction and social support. So this can include something as simple as how you arrange seating in an indoor environment. So taking a look at this figure, you can notice here different types of seating where maybe this would be helpful for a group of people to kind of get together and chat, maybe work on a project together or something, maybe brainstorm ideas for something. Contrast that with different types of seating that maybe offer more privacy, spaces that can help just two people connect, maybe talk about something away from a group of people. And so this can also help to improve people's sense of control of environments. So that would be designing spaces that allow them to choose what kind of social interactions they want to have, whether they want to perhaps mingle with strangers or have a group setting versus maybe more of an individual or private sort of one-on-one conversation with somebody. Now, another example of this is designing for physical activity. So of course, something like an active office would be helpful to inducing physical activity in people in workspaces. And certainly a lot of offices, I think, will move towards this if we ever go back to offices away from remote working. Time will tell. But also something as simple as a well-lit stairwell has been found to help people be more active at work, because if a stairwell is more comfortable, it makes people feel safe, then they're much more likely to use it. And they're much more likely to get that sort of exercise going from different floor to floor, or whether it's during a lunch break to take the stairs instead of an elevator in a building. Now, another really important principle of healthy architecture is designing spaces for different needs, different disabilities or abilities. So this idea of universal design came about in the early 1970s by a researcher named Ronald Mace, and he was a scholar in the US that really wanted to come up with a design principle to create environments that could be accessed and understood by the greatest variety of people. So in other words, designing spaces that are not just meant for one particular disability or one particular ability, but really an inclusive type of design that would be helpful to everybody. This is because different disabilities, both temporary and permanent disabilities, require different design features. So it's not particularly helpful to design a space for only one type of person. It's probably going to be much more helpful, much more useful to a variety of people if you put that variety of people in mind. So this idea of universal design is really a proactive, inclusive design approach that encourages equal participation from different diversities of people with many different types of needs. For an example, just to sort of illustrate this, if you think about something like a ramp here in the image, a ramp isn't just a ramp for someone in a wheelchair. Universal design would tell us that it's also useful for a parent with a stroller. It's also useful for an older age individual, someone with mobility issues, or it could be really useful for someone who's even just recovering from a temporary injury. So this idea of universal design is really just making sure that you're thinking about the design of any feature in a way that would be most beneficial to as many different type of people, not just one particular type of need. So an example of this was in 2016, they built the first ever universal design facility. So prior to this, it was really only applied to particular settings, rooms and buildings. So the YMCA in Michigan, in Grand Rapids, Michigan, decided to build an entire facility based on universal design. So what did this look like? Well, as you can tell here, they included this kind of very wide ramp at an incline that would be most helpful for a diversity of different people. They also made sure to design the space and the layout of the area to have a lot of space, so wider halls, the removal of staircases and repositioning different columns as well, so the physical structures, to make sure that there was room for people who maybe are using accessibility devices of different sorts. They also made sure to use color schemes and lighting for different visual impairments, and also taking into account acoustics to make sure that there is noise reduction being taken into consideration for any people who maybe have audio sensitivities. So this just goes to show that, you know, if you're really going to take the time to design a space that is inclusive for different disabilities, you really want to make sure that you're not ignoring any one particular disability or ability. You really want to try to involve this holistic approach, this universal design principle to approach a problem like that. Now, another example is designing for maternal health. As you may know, labor is a very intense and painful experience, and the mother's mental and physical health is really, really important during this sort of high stress period, this process. So it started to really take off in the last decade or so, this idea of designing hospitals or clinics for birthing to make the environment as comfortable as possible for expectant mothers. So this hospital in Madrid, in Spain, decided to design these natural birth rooms to be a very comfortable experience. And these rooms are located in a regular hospital. So, you know, God forbid, if there was ever some sort of complication, then the mothers would still have access to different types of treatment. But given that these were sort of lower risk mothers, they were allowed to participate in these type of birthing rooms, and they had access to different things that would help them go through the labor in a much more kind of calm environment. So whether that was the use of a water bath, even design principles taking into account different shapes, so things that could help the mother you know, try different positions to sit or to stand to make sure that she was comfortable. Even something like a yoga ball, but also these types of they're called restraints, so that people could sort of pull on them if they're experiencing pain and kind of going through labor in many different positions around the room. But also worth noting that, of course, there's areas for storage, so that medical equipment is stored there, again, if it is required during the birth. Now, this is very, very useful in a sort of high income industrialized context, but what about in places where maybe the birthing experience is a very, very different scenario? What might that look like? How could we design safer, healthier ways to do that? So this example in Malawi is I guess, example of design, not just in one particular facility, but they decided to design this entire village, this entire kind of community center in Malawi, because they realized that the expectant mothers there really, really thrived on this idea of community. So they really relied on, for example, advice from other mothers. They felt much more at ease when they were in the company of other pregnant women, because they could kind of ask questions to other people who were going through the same experience as them. And so the designers really tried to take this into consideration, and they designed an entire village where mothers would still have these kind of separate little almost huts, these kind of building rooms. So they could have privacy, but all of the rooms would open up and they would be sort of welcoming into this environment of this community where other mothers are also waiting for labor. And so other things that they designed in this space were things like community food halls. There's really this emphasis on community activities so that they can, cook together, they can participate in workshops on postnatal care and really learn from each other's experiences versus only this idea of sort of like a clinical hospital environment. So to them, it was much more health inducing to really design a space with the community in mind, not just an individual. So that's just an example of how you really do have to approach healthy architecture in many different ways, particularly given on the specific context of the community or the people that you're designing for. Now, another important principle, particularly these days, is designing indoor environments for infection control. So I found a study, this was pre-COVID, so they were more interested in the impact of measles, particularly spreading in school environments, back when we had other infectious diseases to worry about. And so this study was looking at different control strategies that could be implemented in something like a school setting. And this is because the way that you design airflow, the way that ventilation takes place in an environment, as well as any air purification systems that you install, those can really impact the indoor spaces' ability to control for infectious disease spread. And they really are a key factor of building designs. So this particular study found that when they used a different combination of many different systems, so both an advanced filtration system, as well as a vent, as well as an air purification system, so all three, that really resulted in the highest sort of reduction in the average modeled infected cases of measles. So this does demonstrate that, if you design a space with particular infection control features in mind, then you really can reduce the spread in meaningful ways of different infectious diseases, and particularly airborne diseases, which can be relatively easily controlled with different technologies and different ventilation systems. Now, another example of this designing for infection control is increasingly healthy surface design. And I think this was particularly important back at the beginning of the pandemic, when we didn't really know a whole lot of how COVID spread. And there was this emphasis on cleaning a bunch of surfaces, cleaning your groceries to make sure that you didn't catch COVID that way. But I think over time, we've kind of learned that maybe other methods of transmission may or may not be more important. But in any case, healthy surface design is still a really, really important aspect of healthy architecture. So particularly designing, surfaces in hospital clinics or dental clinics, for example, is really important to make sure that the surfaces are designed with potential antibacterial properties. These are used in a whole host of different healthcare clinics. And as well, if any of you ride different public transit, you may have noticed as well, especially in the last year, this emphasis on really making sure that high touch surfaces in places like buses or streetcars or subways, whatever it is, that those are sprayed down with antimicrobial sprays to make sure that any germs are killed off in that way. Now, I want to take some time to go through this case study of long-term care homes in Ontario, because it is worth taking a moment to recognize this tragedy that has unfolded in long-term care homes all over Canada, but especially here in Ontario. Many of the design features of different long-term care homes in Ontario have been sort of emphasized over the course of this pandemic, and how they may or may not have contributed to the spread of COVID in these settings. So we'll take a little bit of time to kind of look at that. So in January, just a few months ago, Ontario's COVID-19 Science Advisory Table released a report. And in this report, they were looking at the first as well as the beginning of the second wave of COVID back sort of last spring, as well as last late fall. And they wanted to know, specifically in the context of long-term care homes, what factors really exacerbated the outbreaks that occurred in these homes. What potential factors, especially related to the care homes themselves, what made those homes sometimes safer and sometimes more dangerous for COVID risk. So This is particularly important because as of January, more than half of COVID-19 deaths in Ontario were from residents of long-term care homes. So this is not an insignificant proportion of the population when we're talking about really the burden of COVID in Ontario. So what this report found was that the most important risk factors that predicted the severity of the outbreak of COVID in the home had to do with older design. So this is particularly true for older long-term care homes that maybe had insufficient ventilation, but also maybe rooms that were designed to kind of make crowding easier because they didn't have the spacing required to keep patients isolated if one was infected with COVID, for example, and one was not. But also things like who owned the chain. So for example, it has been kind of widely reported at this point that in Ontario, the for-profit resident long-term care homes were the ones that were usually overburdened by COVID compared to those that were owned by nonprofit corporations as well as by the municipal governments, particularly here in Toronto. You have quite a few of those municipal. Now, another thing that they found was that crowding, unsurprisingly, was a really, really important predictor of COVID-19 deaths in long-term care homes. So the more crowded you had a home, the more likely they were going to experience an outbreak of COVID-19 deaths. But I want to emphasize that it doesn't have to be this way. There is hope. In fact, this idea of designing healthy spaces for senior care is not at all new. Unfortunately, it just maybe hasn't been prioritized enough up until now. So for an example, designing spaces with mobility impairment is really, really important in aspects of seniors care. So making sure that you have wide doorways, automatic doors for anyone who might be using a wheelchair, for example, but also designing for vision and hearing impairment. So really emphasizing things like bright colors to aid the navigation of hallways, creating light around doorways to make sure that those are easily identifiable, but also taking something into account like acoustics in order to minimize echoes. For those who are hard of hearing, that can be really distracting and can make it really, really difficult to, listen to instructions from a nurse, for example, if you can't properly hear them. This idea of designing for social interaction as well is really, really important in seniors care, whether that's including spaces for activities to make sure that visitors can come and visit with their seniors, but also designing for something like dementia, which unfortunately is a burden that many people in the seniors population do have to face. And so things like using personalization with family photos inside long-term care homes can be really, really helpful to help patients orient themselves and kind of trigger memories. But also there's a really interesting long-term care home that was designed in Ohio, and it's called the Lantern of Chagrin. And so what they did in this particular home was build these different homes that are designed to look like these sort of 1940s typical, middle America homes, something that most of the patients likely remember from the time that they were younger and sort of early middle age or teenagers. And so this is designed to help them feel safe so that it's not this kind of like foreign environment that they don't recognize, but more so to stimulate, their memories and to help them feel at ease in a space that they are likely to kind of think back to in their early memories that they still have. And of course, access to the outdoors and nature is really, really important. And to illustrate that, this was a study that was done in the UK. And what they found was that among patients who were exposed to a nature garden, so those patients with dementia who they took out for a walk in a nature garden, the exposure there was associated with a beneficial change in patient mood. But what they did find, interestingly, was that it did tend to plateau. So after, about an hour and a half, patients no longer started to feel that improved mood. In fact, they started to feel a little bit stressed if they were outside for too long, which again is probably a little bit obvious, particularly for someone like a senior where they might have many needs. They might have different levels of comfort with the outdoor environment and feeling safe and secure. And so they maybe don't want to spend too much time outdoors. Now, I want to highlight an example that's a little bit more local to many of us. Many of us are familiar with Peel region, the areas around sort of Mississauga and Brampton in the GTA. And so this was a long-term care home called the Butterfly Home in Peel region. And this started out in 2017. And it was a home that took on this model of the butterfly household, which was designed in the UK. And what makes this type of home so special is that they really focus on an environment with compassionate care versus a sort of clinical medical environment. So what they do is that they make sure that the activities are much more emotion-based and task-based. And in fact, the residents are encouraged to respond to patients with human touch. So whether that's something like holding hands or offering hugs to support residents, really making sure that they're in tune to the emotional needs of those residents. And so they have found, as a result, that staff sick days were down at this particular home. They found that fewer residents were falling because they felt, much more secure, more safe. They were willing to ask for help if they needed it, if they felt dizzy, for example. But also the use of antipsychotic drugs was lower because residents were feeling much less stressed. And of course, their social engagement was significantly higher because they were interacting a lot more with other patients as well as other staff in the home. So unfortunately, this kind of home has likely been put on pause due to the pandemic and just the inability for many residents to have that kind of close contact with other humans. But Peel Region did use the model at one other home, and they've started to look at expanding it to others. So who knows, maybe this type of model for compassionate care will really take off and start to change how we approach these long-term care homes, both here and abroad. Now, another really interesting aspect that I wanted to highlight, this is for senior child interaction specifically. And this is because it has been well documented that seniors tend to bear the brunt of a lot of loneliness and feelings of isolation. And this, of course, has been linked to declining health and increased risk of mortality among seniors for a whole host of different health reasons. And of course, in a post-COVID world, hopefully many of these types of intergenerational activities will take off again. So this is an example of a long-term care home here in Toronto, where they also have a daycare located in the same facility. And so it wasn't uncommon pre-COVID for during parts of the day, they would take the children up to go actually play with the residents of the long-term care home to really get that sort of back and forth between children and seniors. And they found that it just really improved the mood of the senior residents, but also it was really helpful for the children. They were fascinated by senior age people. They could ask them questions, and it really proved to be a beneficial sort of activity for both. So again, hopefully in a post-COVID world, we might see the popularity of these types of initiatives really take off again in terms of combining senior care as well as daycare, different types of programs like that. So we are more or less at our time for the day. So I think I'm going to stop there. I had a couple of slides, but we can always pick that up tomorrow. So if anybody has questions now, let me know. And again, tomorrow we're going to have the guest lecturer come on and talk more about outdoor spaces. So definitely save any questions about that for tomorrow.